with the phlebotomy, with the chapter 4. Okay, as you see, okay, for each process in the clinical laboratory, we are going to talk about the quality assessment or quality control. And the accuracy of the laboratory testing begin with the quality of the specimen received by the laboratory. Okay? The quality depends on how specimen was collected, transported, and proceed. And as we know, errors can occur before, during, and after blood collection. Okay, and therefore we have to pay attention once we received a blood samples, because it will affect the total quality of test results. And now you also know that we already discussed the leading cause of pre-analytical errors include patient's identification error, inappropriate specimen collection tube or container. Okay, if you withdraw the blood sample in a inappropriate tube or container, there are several types of the test tubes. Each tubes may include the anticoagulants or additives. I'm going to discuss with you in these lectures. And specimen collection tube not filled properly is another pre-analytical errors. Okay? Since there is some amount of the anticoagulants or additive in the tubes, it should be proportional to the total volume of the blood. And therefore, you have to fill the test tubes in order to get a correct results. Okay, test request errors, other pre-analytical errors, okay, it may cause from the physicians, okay, if they request a wrong test, okay, which also affect the total quality of the test results. Okay. The infection control, other concern in terms of the blood collection, and the chain of infection requires a continuous link of three primary factors. These are reservoir, means of transmission, and susceptible host. Okay. Reservoir, an infection, infected symptomatic or asymptomatic host, we call reservoir, and a contaminated objects, food or water, is a means of transmission, and a patient or a healthcare worker or visitors can be a susceptible host. Therefore, we need to take a precaution to prevent infection due to the blood collection. Okay, now the standard and additional precautions to prevent infection disease are several. As you see, to stop the spread of microorganisms through direct contact or indirect contact. Okay, direct is skin to skin. Okay, what does it means? How you can protect yourselves or prevent the transmission of disease or spread of microorganism, okay, wearing gloves, gown, or lab coats maybe stop the spread of the microorganism. Also, indirect contact, usually the result of a person making a contact with a contaminated materials. Okay, okay. If you wear gloves, okay, and lab coats or gown, they also may also protect yourselves and other lab workers. Now, there are some precautions for droplets or airborne. We know we already learned a lot about such precautions in the last years. Okay, to stop a spread of microorganisms through droplets, which may be expelled during coughing, sneezing, or talking. Okay, wearing a mask may be most protective precaution that we can do, and to provide protection from airborne bacteria or dust particles, which may be suspended in the air for an extended period. Okay, as you see, airborne infections are different from the droplets ones because they are suspended in the air for an extended periods. Okay, for such microorganism which spread through the airborne, okay, also wearing mask or rinsing the workplace frequently may be two important precautions that we can follow. In some cases, isolation of the patients or suspect may be a kind of the precaution that we can take. Okay, now it is your turn. Okay, which transmission-based infection control precaution stop agents dispersed by talking, coughing, and sneezing? Okay. If you pay attention while I am lecturing, you have to give a correct answer, but no worry whether your answer is true or not, okay? I want you to send your responses to these questions, okay? One more. Participation is crucial, right? Okay, if you don't have a smartphone, you can use chat box, but I like to see your answer via smartphones, okay? Now let's see, okay, airborne precautions and droplet precautions. Okay, the correct answer is supposed to be C. Let's see. Yes, C is the correct answer. Okay. If you take a look later, you will see the correct answer on the slides. Okay, but no worry, I don't care whether your answer is correct or not, because now we are discussing and trying to find a correct answer. Okay, otherwise you will make the same mistake during the quiz or exam, right? Which is not good for you. Do the mistake during these trainings, okay? Not in the quiz, in real actual quiz or exams. Okay. Now, a specimen collection was a most important step of the total quality of clinical labs, and the phlebotomists are a laboratory ambassador, and they play a crucial role to collect specimens, okay, uh, and therefore their knowledge, their experience, how to collect specimens, how to transport these specimens to the lab and for process is important. Now, blood collection variables are also important. There are controllable and uncontrollable biological variables. Okay, let's say meal, posture, immobilization, exercise, circadian or diurnal variation, smoking, or alcohol ingestion may affect the test results. Okay, these are controllable variation that you can prevent the side effect of such variations, right? However, there are also uncontrollable biological variation, such as age of the patient, gender, ethnicity, okay, or the season of the year. These are out of our control, right? But they also may affect the test results. Okay, now we are focusing on the variation that are controllable. Okay? And there are three main sources of the blood collection: and venous, capillary, and arterial bloods. Okay, two general sources are venous and capillary. Okay, maybe most common one sources is venous blood collection. Then second is capillary, and third is arterial blood, may be used for blood cases. Okay, now, once you collect the blood, as you see here, the layers of the normal anticoagulated bloods, plasma, buffycoats, and erythrocytes. You may notice that about 55% of the total blood volume, okay, is plasma, okay, and 45% is erythrocytes. Okay, now as you see in these diagrams, okay, about 90% of the plasma is water, okay, 55% of the total blood is plasma, 45 is formed elements or erythrocytes, okay? Now, the Buffy code, you may not see always with your naked eyes, okay, which consists of leukocytes, thrombocytes, and platelets, okay, and thrombocytes, platelets, and thrombocytes are the same things. Okay. However, the the most part of the cells, blood cells, are erythrocytes, about 99%. Okay. Now, what is difference between plasma and serum? As you see, if you collected blood into anticoagulated tubes, you prevent coagulation of the blood, okay, and you will obtain plasma, okay, and red blood cells, okay, without coagulation, clotting, okay. Now, if you withdraw the blood into a tube without anticoagulants, that means the blood will clot, okay, and the supernatant, which we call serum, and the precipitants, which is non-clot. Okay, now, as you see here, okay, now the differences between plasma and serum, okay, we collect plasma via anticoagulants, okay, prevent coagulation of the plasma, and therefore in the plasma, in the supernatant, which we call plasma, there are clotting factors, okay, present in the plasma, okay, such as fibrinogen and other clotting factors, okay. Once you centrifuge the anticoagulants bloods, patient blood, they will separate it in two parts, plasma and red blood cells and platelets, okay. Now, serum without anticoagulants, okay, that means you allow the blood clotting, and the clotting factors will spend it, okay, will use it during the coagulation, clotting of the bloods, and therefore in the serum, okay, there is no clotting factors, okay. The main difference between plasma and serum, in the plasma still there are clotting factors such as fibrinogen and other clotting. There are tons of clotting factors, and in the serum, okay, there is no clotting factors, okay. Now we are collecting the blood into test tubes. These are evacuated tubes. We call evacuated blood collection tubes. Okay, there is a vacuum in these tubes, and therefore these tubes may be affected by ambient temperature, altitude, humidity, and light, because they also, some of them include anticoagulants and such kind of additives. They may be affected by lights, and therefore storage of such tubes is important. And also the expiration dates of evacuated tubes need to be known, okay, because the shelf life of the evacuated defined by the stability of the additives and the vacuum retention. Okay, you need to check the expiration date of test tubes before you use it. Okay, if they expired, they may be lost their vacuum. Okay, or the additive may be spoiled, and therefore you may discard such kind of test tubes. Okay, the inclusion of additives at the proper concentration enhance the accuracy and the consistency of the test result. We are fortunate now most of the test tubes are ready for use. They already included additives and anticoagulants at the proper concentration. However, for these test tubes, you have to fill the test tubes with a blood, because the ratio between additives or anticoagulants and the volume of the blood that you collected is important. Okay, if you withdraw less amount of the blood, you will change the ratio between anticoagulants and okay, something is wrong with the internet connection. Can you hear me now?
Yes, we can hear you.
I'm going to change my internet provider by next week.
We just can't see your screen.
Okay, okay, okay. Don't you see my screen?
No.
I can't see it.
Okay, I may stop share. And then now let's see, share them again. Specimen collection here. So, how about now?
You can see it.
Yes, we can see it now.
Can you see
Yes.
my screen?
Yes. We could see it, but now we can't anymore.
Okay, now I'm going to do them again. Now, can you see now my screen?
Yes.
Okay, thank you. Now let's see. Okay, I mentioned anticoagulants and additives. Okay, what are the anticoagulants that we are commonly using? Okay, you may know some of them. Okay, the anticoagulants which prevent coagulation of whole bloods, ADTA, okay, which is the most common anticoagulant that we are using, sodium citrate and heparin, okay, the other common anticoagulant that we are using. And we also sometimes we using additives, okay, clot activators, okay. If you want to clot the blood in a short time, you may add some clotting activators such as magnesium, calcium in the test tubes, or serum separators. Okay, some test tubes, they already include separators, and preservatives such as sodium fluoride, which inhibit a glycolysis in the whole blood in order to prevent glucose um, being oxidized. Okay, and we in some case we use the tubes which include sodium fluoride. Okay, now, however, such kind of anticoagulants or additives have some interferences with the assays, with the lab tests. Okay, we need to consider what kind of adverse effect of the anticoagulants or additives we have. Okay, which tests will be affected from such kind of additives. Okay, they may remove a constituents from the blood, okay, which result in lab errors, or some of them may affect the enzyme activity. If you are going to measure the enzyme activity due to the test, lab test, if you are going to measure the kidney enzymes activity, they may be affected from additives or anticoagulants. We have to know that. Okay, alteration of cellular constitutions or incorrect amount of the anticoagulants also may affect the test result. As I said, there is a constant proportion between anticoagulants and blood, total bloods. You have to consider this proportion. Okay, usually 1 in 10 as a proportion. 1 portion anticoagulants, 9 is blood, whole bloods. Okay, and if you withdraw low amount of the bloods, you will change the ratio between anticoagulants and the total blood that you withdraw. Okay, therefore the evacuated tubes should be filled enough in order to keep the ratio between the total blood and anticoagulants or additives. Okay, now, as you see, colorful tips, there are several test tubes with different color of the stopper. And the presence or absence of additive in evacuated tubes is indicated by different colored tube tops or stoppers. Evacuated tubes and microtrainer tubes have various color-coded stoppers, okay, determined by the manufacturer, and this stopper color denotes the type of the anticoagulants and additive or the presence of the gel separator. As you may notice, on the some test tubes, you also have enough information. Let's see these test tubes, which is blue with blue stoppers. As you see here on the label, this is for coagulation test. Okay, and all these tubes are sterile. Okay, and included vacuum. Therefore, we call vacutainer or evacuated test tubes. And as you see, these green stoppers tubes include heparin. Okay, this is a gel, included gels. Okay, separated for separation serum from the clot. Now, okay, the glass collection test tubes are being replaced with the safer plastic tubes. Nowadays, we are using plastic test tubes mainly, okay, just only for some special tests we are using the glass test tubes, very rare. Usually the name of the laboratory test is indicated on the patient requisition, and therefore if you withdraw the blood, you have to take a look at the requisitions, um, the patient's requisition first, and see what kind of the test requested from the physicians, because we have to know which kind of the test tubes you are going to use. Okay, each tube has different anticoagulants, additives, and the purpose of each tube is different based on the test and the test that requested, and therefore you have to choose the appropriate test tubes. Okay, if you know which test is requested and for which test tube that you are going to use, okay, it is not a big deal. Okay, you will learn before you uh, um, going to withdraw a blood. Also, there is a directory manual. Okay, in each laboratory, you can take a look. Okay, which test required, which kind of a blood, and which test tube should be choose, and how we proceed the blood, how we store such kind of bloods. Okay. Okay, sometimes you are going to collect blood in a few tubes, test tubes, and the order the tubes is also maybe important in order to diminish the possible cross-contamination between tubes caused by different additives. Because, as I said, they include different additives or anticoagulants, okay, in order to prevent cross-contamination. You may follow a, um, I mean, a order of the drug, okay, which provided by each labs. Okay, you will be told before you are going to withdraw the bloods. Okay. Okay. Now, when the coagulation of fresh whole blood is prevented through the use of anticoagulants, the starved colored fluid that can be separated from the cellular element is known as, okay, now it's your turn. Are you there?
Yes.
Okay,
Yes, we are.
Okay. I wish that I will be able to see behind the screen, but unfortunately I can't. Okay, send your answers. Okay. Okay, the supernatant, the fluidic part of the sample. Okay, let's see what says. Okay, the correct answer is the plasma. Okay, if you collect the whole blood with anticoagulants, okay, the supernatant, the fluidic part of the tubes will be is known plasma. Okay, if you collect a whole blood into a test tube without anticoagulants, the supernatant is known serum. Okay, I am going to show you later again. Okay, don't worry, send your answers. Now let's see. Okay, an evacuated tube with ADTA has colored stoppers. Which kind of colored stopper has it? I am going to show you later again, but if you pay attention, the slides that I showed you, okay, the evacuated tube with EDTA has a red, lavender, blue, green, none of above. Come on, guys. Two more. Which color do you like? Let's see. Lavender is correct. Purple or lavender is correct answer, okay? It's okay, no worry. Okay, now the answer you will see here, that as you see, these are different kind of test tube that we are using in clinical laboratory. In the clinical laboratory, the tube with black topper include sodium citrate, okay? And these tubes only is a glass test tubes that we are using for erythrocyte sedimentation rate, ESR, okay? And light blue tubes, okay, a tube with light blue stopper includes sodium citrate for coagulation tests, okay? This is with glass, the rest of tubes are plastic, okay? The red tube, okay, no anticoagulants, okay, for chemistry, drug levels, and blood banking, okay, with a lavender or purple stoppers, which include EDTA, is for hematology, okay, erythrocyte sedimentation rate, blood banking, okay, such as blood grouping, RH, or antibody screening tests. Okay, the gray stoppers, okay, tell us that these test tubes include sodium fluoride, okay, which for glucose measurements. Because sodium fluoride inhibit glycolysis, okay, and prevent the glucose being oxidized via the glycolysis metabolic pathways. And the test tube with green stoppers include heparin. Okay, heparin, other kind of the anticoagulants, which we use these test tubes for chemistry, hematology, blood gases, electrolytes, and ionized calcium. Okay, the yellow test tube, which include acid citrate. Okay, and these test tubes for molecular diagnosis, blood culture, and cytogenetics. Okay.
Dr. Adam,
Yeah.
what was the answer to the question about the coagulation of fresh blood is prevented through the use of an anticoagulant?
Okay. The answer is plasma.
Plasma. Okay, thank you.
If you use the anticoagulants, the supernatants, the fluidic part of the test tube will be is now a plasma. If you don't use anticoagulants, is known as serum. Okay, and the difference between plasma and serum is the clotting factors. The plasma include the clotting factors because there is no coagulation in such test tubes, okay? But there is no clotting factors in serum, okay? Now let's see venipuncture.
It's one of the most common procedures you'll learn. We begin with the needle, vacutainer, and blood tubes. A blood pressure cuff can serve as a tourniquet to help you raise a good large vein in the antecubital fossa. Tying the tourniquet properly takes a little practice. The universal precautions for this procedure begin with gloves and careful cleansing of the skin with alcohol or betadine. Carefully remove the cap to unsheath the needle. Insert it into the yellow vacutainer and screw it into place. Then lift the needle guard and remove the cap. You'll see that the hole in the beveled edge of the needle is facing up and is in line with the needle guard. Take a shallow approach to the vein and the blood flashing back into the vacutainer confirms you're in. If you don't see the flashback, stop. In this example, we're drawing a couple of tubes for the lab. Gently oscillate the tube to mix the blood with the heparin or stabilizing agent in the tube. To switch tubes without causing the patient discomfort, you want to steady your hand against the arm. Then you can pop in the next tube without pushing the needle any deeper. And as we finish, one pull of the tourniquet. Place the cotton ball above the puncture site, not directly on the needle. Withdraw the needle straight back and roll the cotton gently over the puncture, applying steady pressure. Having the patient bend at the elbow to hold the cotton in place can create unnecessary bruising. Flip the needle guard back into place, protect the puncture, and the sharp goes right into the container.
Okay. Now, okay, venipuncture procedure is one of the most common procedure that we collect in the blood. As we watch in the videos, okay, here you see in these diagrams the container or test tubes, right? And you have here needle, okay, and this is in the black, which is here holder, okay, and double pointed needle holder and test tubes or container or vacutainer or evocated test tubes. There are different names. Okay. Now, okay. the general protocol for a collection of the specimen for venipuncture. First, pleasantly introduce yourselves and explain the procedure to the patients. This is the first step. Then identify patients, at least with 2 identifiers, and ask patient about medication. Check the test requisition in order to use the proper test tubes, right? If you don't check the test requisition, okay, you won't be able to collect the blood into proper test tubes. And label the specimen, okay, is the last step for venipunctures. Okay, these are supplies and equipment that you need, which we also watch in the videos. Test requisition is important because you don't know which test tube that you choose, okay, and therefore you need to see the test requisition, tourniquet, sterile disposable needles, needle holder, and test tubes, alcohol or betadine, any special equipment or adhesive plastic strips that maybe you need for blood collection for blood withdrawal. Okay, and most important procedure to choose the correct way for withdrawal. Okay, there are several, that means a few options for that. As you see, these are veins in the antecubital fossa, okay, cephalic vein, median cubital vein, or basilic vein, or dorsal veins are here, okay. It depends on the patients and the structure of the veins, okay, that you choose one of them in order to collect the blood. Okay, and unfortunately there are some specific situation may result in a difficult venipuncture or maybe a source of pre-analytical errors such as intravenous lines. If patient has a intravenous lines, okay, you shouldn't take, sorry, I am going to give a break after this slides, okay. You shouldn't take a blood from the site of the intravenous lines, okay? Or if patient has a edema, okay, it is really will be hard to find the vein and take a blood, withdraw a blood. Scarring or burn patients also maybe one of other difficulties, okay, because you won't be able to see the vessels, okay, the veins due to the scarring or burn patients. Dialysis patients also may be because usually they have a intracate in one arm, and you have only one options without intracates, and the vessels of the dialysis patients is usually hard to go through with the needles because of the atherosclerosis, and in some in the mastectomy patients, okay, you know the mastectomy, the surgical removal of the breast, maybe also a, a kind of the difficulties because due to the mastectomy, you also remove some of the vessels. Okay, you may damage the stream of the blood, and in such case, maybe difficult to withdraw the blood from such patients. Okay.
Bye. Have a good day.